Right now, under the leadership of Senate Republicans and President Trump, the federal government is entering its fourth week of the shutdown. Tonight will officially make it the second longest shutdown in American history, the longest total government shutdown in history. 21 days. 21 days of federal workers missing their paychecks. 21 days of families wondering how they're going to pay the rent or pay for child care. 21 days of dysfunction by this administration because the party in power would rather suffer a shutdown and negotiate with Democrats to lower costs. While millions of Americans are feeling the squeeze, the House is on vacation. And Senate Republicans, well, they're at the White House today, not for negotiations or to work on any path out of the shutdown, but for a pep rally. And as I've understood it, when they made comments afterwards, they didn't even talk about health care once, as I understand it, because they just finished. That's right. Republicans today will join the president to celebrate staying strong, being unified. So as millions of Americans continue to endure the pain of one of the longest shutdowns in American history, Republicans will be celebrating keeping it going. Isn't that a disgrace? Apparently, Republicans don't have the time of day to fix people's health care, to lower costs, but there's plenty of time for a photo op and celebrate their pain. Let me be clear. Americans don't have time for Republicans and Trump's parties. The pain for families is intensifying as notices continue to go out in the states. Every day this shutdown drags on. More families are getting letters from their insurers warning them that their premiums will skyrocket. For more than 20 million Americans, steep premium hikes, increase of 114%. Hundreds of millions could do more, hundreds of millions more could see their costs skyrocket next year because it's going to go up for everybody, not just those on federal insurance. And that's not a headline. That's real life. That's food off the table. That's saving accounts drained dry after years of building them up. So time's running out. If Congress doesn't act by October 31st, millions of Americans will see higher premiums when open enrollment begins November 1st. The decisions made or not in the next 10 days will determine whether working families can afford their health care next year. And Americans are desperately looking to Republicans, the party in the majority, to do something about it.